Hello, my name is Erin Cloutier. I'm the Director of the Practice Support Team here at Charlotte AHEC. The following presentation was created by Kim Brady, a CHEC Practice Support Consultant, to help Medicare providers understand how the program will impact future Medicare payments as they transition to the new Pay-for-Value CMS Quality Payment Program. Just a quick review of how MIPS works. MIPS has 4 categories: quality, advancing care information, cost, and improvement activities. When you take a closer look at these categories, 3 will look very familiar to you. Quality is the replacement for PQRS. Advancing care information is the replacement for meaningful use. And cost is the replacement for the value-based modifier. The 4th category, improvement activities, is the new kid on the block. Today we are going to talk about the Advancing Care Information category, or ACI for short. For 2017, the first year of the Quality Payment Program, CMS has allowed providers to pick their own pace. And just by submitting a minimum amount of data, such as one quality measure or improvement activity, or the ACI base score measures, providers can avoid a downward adjustment for 2019 payments. To earn a neutral or positive adjustment, providers will need to submit 90 days or a full year of 2017 data. As you just heard me say, the ACI category in MIPS replaces the Medicare EHR Incentive Program, or Meaningful Use. This performance category is tailored to focus on the secure exchange of health information. It promotes the use of certified electronic health record technology to support patient engagement and improved healthcare quality. As you prepare for MIPS, you'll want to note that this category is weighted at 25% of the total composite MIPS score. CMS has provided flexibility with this category by providing opportunities for extra points. We'll get back to that in a minute. In 2017, eligible clinicians may choose to report ACI with 90 days worth of data, or data for the full calendar year. To be eligible to report in this category, you must have certified electronic health record technology. If you have been successfully reporting meaningful use, you are already using certified technology. An important detail to note about reporting in 2017 is that there are 2 measure set options for the Advancing Care category. The addition of your certified EHR determines the ACI option you'll take. Option 1 is called Advancing Care Information Objectives and Measures, and Option 2 is 2017 Advancing Care Information Transition Objectives and Measures. You will be able to report using technology certified to the 2015 edition or technology certified to the 2014 edition, or a combination of technologies from 2014 and 2015 editions. If you are unsure which edition your EHR is certified to, you will want to contact your vendor to check. CMS reduced the total number of required measures from 11 in the proposed rule to only 5 in the final rule. The other measures are optional for reporting. Reporting on all 5 of the required measures would earn the MIPS-eligible clinician 50% credit in the ACI category. Reporting on up to 9 additional measures will allow a clinician to earn a higher score. In other words, by attesting to just the base required measures, an eligible provider will earn half of the 25% weight of this category. To learn more about calculating your total composite score, please make sure to view our HEC Talk video on calculating composite score. First, let's talk about the measures that are required for a base score. You are probably thinking, base score. Sounds a little different than meaningful use already. To receive the base score for the required measures, you will either report 4 or 5 measures. Earlier in the presentation, I told you that there are 2 options for reporting ACI measures, and that the option you choose will depend on your EHR certification. If you are reporting using Option 2, 2017 Advancing Care Information, Transition Objectives and Measures, you will have 4 required measures and will not have to report Request Accept Summary of Care. Again, check with your vendor if you're not sure which option you'll be using to report. If you have attested to meaningful use, the base score measures will look very familiar to you. They are Security Risk Analysis, e-prescribing, Provide Patient Access, Send Summary of Care, Request Accept Summary of Care. Now that you know what required measures are included in the base score, let's talk about how the base score is calculated. First, it is important to understand that to receive any score in the ACI category, clinicians must fulfill the requirements of all base score measures. You can't get those extra points if you haven't met the required measures. It is all or nothing. The good news is it's not so hard to achieve, especially if you have already successfully attested to meaningful use. The requirements are submit a yes for the security risk analysis measure and at least a 1 in the numerator and denominator of the remaining measures. Simply put, you must have conducted a security risk assessment and attest that all of the other measures have been fulfilled at least once. For example, at least 1 permissible prescription written is queried for a drug formulary and transmitted electronically using certified EHR technology. At least 1 patient has been provided timely access to view, download, or transmit their information. Now that you know how to achieve the base score of 50%, let's work on getting some additional points. If you recall, I mentioned earlier that you could possibly get up to 155% in this category, with a cap set at 100%. Sounds good, right? You'll want to visit the Quality Payment Program website to take a look at the available measures. You may choose up to 9 measures for additional credit to earn a performance score of up to 90%. Choose the Advancing Care Objectives and Measures or the 2017 Advancing Care Transition Objectives and Measures. Remember, your choice here will depend upon the version of your EHR. For today's example, we'll choose the 2017 Advancing Care Transition Objectives and Measures. As you can see, there are 11 measures. If you want to know more about a measure, choose the drop-down. For this example, we'll choose Patient Education. As you can see, this is a measure that is not required for the base score and is weighted up to 10%. Now back to the scoring. You are likely used to meeting a threshold for meaningful use performance. For example, the meaningful use medication reconciliation threshold is 50%. In MIPS, the ACI performance score is calculated by determining the performance rate. Most measures are worth a maximum of 10 percentage points. As the example in the slide shows, if you have a numerator and denominator of 85 over 100, the performance rate would be calculated at 85%, and you would earn 9 out of the 10 percentage points, or 9% for that measure. There is one more very important thing to know about your Advancing Care score. Bonus points may be achieved. A 5% bonus is awarded for reporting yes to 1 or more public health or clinical data registries other than the immunization registry. And a 10% bonus can be achieved for reporting an improvement activity using your certified EHR. Make sure to check out the list of activities that qualify for this bonus on the Quality Payment Program website. Now, let's take a look at an example for the total score. The clinician achieved the base score of 50%, a performance score of 25%, and a 5% bonus score, totaling 80. As you recall, the weight of the ACI category is 25%. So in this case, the clinician would have a total MIPS score of 20%. As you prepare for MIPS reporting in the Advancing Care category, be sure to choose which additional measures you will report on early in the year. Check your progress on the measures frequently, and look for opportunities to score additional performance and bonus points. Thank you for joining us today. I do hope you have found this information helpful. Be sure to check out our other HEC Talk videos on YouTube as you prepare for your success in the Quality Payment Program. Thank you for watching this HEC Talk. Your feedback is valuable to us and will help us to bring you more information on the topics you need to know about. Please provide us with your valuable feedback by clicking on the link in the video description and answering our short 2-question survey.